Hello, welcome to video 12. Let's build on the innovations we covered in the last video and take them further. In the previous video on justice issues, we discussed two major innovations. Law enforcement facilitated access to treatment through deflection, and treatment-first drug courts that initiate treatment immediately after arrest to prevent overdose. Now we turn to other important initiatives in the book, ones that can make a real difference with federal financial and political support backing them up. Disrupting drug markets does not automatically increase treatment entry. In fact, evidence shows that sudden supply reductions can increase overdose risk. People facing withdrawal often seek out unfamiliar dealers and more dangerous drugs. So enforcement, when it operates without health interventions partnering with them, can unintentionally make outcomes worse for people who already use drugs regularly and have developed a chronic addiction to powerful drugs such as fentanyl. For much of my career, I thought cutting people off from their supply would cause those with a regular drug use habit to go seek treatment. I was surprised when I learned through research and experience that this was wrong. It doesn't mean drug enforcement isn't important. It is. And it doesn't mean that some people who lose access to the drug dealer don't seek treatment. They do. But overall, I think it's accurate to conclude, I know it's accurate to conclude, that enforcement operations alone, major arrests or seizures, does not trigger widespread treatment entry by those who suddenly lose access to their regular dealer or drug of choice. So that's an important finding to take into account and when we look at how drug enforcement can be as impactful as possible. Drug enforcement, however, does create a window for action, one that for the most part has been wasted. That needs to change. What if, when a major enforcement operation occurs, the health system is ready to act at the same time to reach out to drug users that are impacted? This requires some advanced coordination between police and health agencies, and it means outreach teams and recovery coaches must be ready to deploy into the areas impacted by the drug enforcement operations. These outreach teams can make a real difference. Not only can they distribute naloxone, they can also offer immediate access to buprenorphine to ensure those dependent on opioids do not go into withdrawal and have time to seek care. They can also directly facilitate treatment entry, and recovery coaches and peers inspire hope and explain what low threshold drug treatment programs are available in the area and again facilitate entry into such programs. The goal is straightforward: reduce overdose risk and accelerate treatment entry during and right after market disruptions. Today, we usually fail to utilize this hard-earned window created by effective drug enforcement operations, which again are important and need to continue. But with modest planning and coordination, drug enforcement can open up doors to care rather than leaving people vulnerable to potentially fatal drug overdoses. So let's move on to another proposal in my book that I think is important for moving forward in this increasing treatment entry. We already coordinate drug enforcement regionally, and now we must do the same for drug treatment. This really looks at a very significant structural gap in our treatment systems today. Hard-hit regions rely on a fragmented approach to treatment entry and coordination. Hospitals, providers, health clinics, street outreach teams, NGOs, and justice agencies engage with the same people, problematic chronic drug users, but without a shared structure for coordination and collaboration. Yet the federal government already knows how to fix this type of multi-jurisdictional coordination problem. For decades, it has funded regional drug enforcement coordination through task forces, included the high-intensity drug trafficking areas HIDTA task force program, which was run and is run by the Office of National Drug Control Policy, where I worked for many years. This chapter calls for a parallel, federally funded treatment coordination model built on the same logic of the HIDTA drug trafficking task force program. These treatment coordination task forces would operate in the 50 regions with the highest overdose and addiction burden in the country, pool resources and address gaps in services, break down silos, share data, and provide sustained regional leadership, bringing together all the key players regarding treatment entry in a region. In short, they would do for treatment coordination what HIDAs have long done for drug enforcement. Bring the region together to work jointly on a shared problem. And if there's something that the region needs, which is lacking, a service, a facility, some key staffing, they can work together to find a way to pay for it using their extensive collected network of relationships with government at every level. This approach works for drug enforcement. Let's put it to use to enhance the effectiveness of drug treatment systems. The lesson of these past two videos is that justice and health are not competing fields. Uh, it's not that advocates and policymakers should choose one over the other. Both are critical. Both offer powerful and necessary capabilities to combat addiction, overdose, and drug-related crime. But those capabilities are most effective not when they operate alone in silos, but when they operate in coordination and collaboration. This is not a theoretical argument. It's not a new idea. I've seen these approaches work on the ground in real communities during my time as acting drug czar. They were built by courageous police officers, public health leaders, and recovery professionals willing to challenge old assumptions and try something different. What these last two videos offer is a way to take these proven innovations and scale them nationally so that many more lives can be saved. In the next chapter, we turn outward to border interdiction and global supply control, and examine how these efforts fit into a true defense in depth strategy against today's drug threats. So see you for video 13. Thanks very much.